Hello everyone. Today our topic is mechanism of labor or cardinal movement of normal labor. This topic is very important and easy topic also. This topic it's very useful for you theoretical part as well as the practical part. So once you listen the class, you can write in the exam with very confident. So here I will explain very briefly how the normal labor is going on. What are the stages are there? What are the parameters? What is the normal position? How the mechanism is going on, that everything I will discuss. So let's move on the topic. First we will see what is the stages. We have the four stages: first stage, second stage, third stage and fourth stage. What is the meaning of first stage? First stage is true labor pain to fully dilation of the cervix, that means 10 centimeter. And second stage, fully dilation of the cervix to expulsion of the fetus, that is the second stage. Third stage, expulsion of the fetus to expulsion of the placenta. Fourth stage, that is the observation after the delivery up to 4 hours. These are all the stages: first stage, second stage, third stage and fourth stage. Next, we are moving to the position. We have the many position. For the normal delivery, we have only two position, that is the left occipital anterior and right occipital anterior. But most common position is left occipital anterior. So next, we moving to the parameters. What are the parameters is available for the normal delivery? We have the lie, we have the presentation, we have the presenting part, position, attitude. That also we have to know. Lie is longitudinal, presentation cephalic, presenting part vertex, position ROA or LOA, but most common LOA, left occipital anterior. Attitude is good flexion, denominator is occiput. So these parameter we have to know when you are writing the exam. Then we will move for the mechanism of the labor. The mechanism, we have some important headings. Based on that, we will explain all the things. Okay. The first mechanism is descent. Second mechanism is engagement. Third, neck flexion. Fourth, internal rotation. Fifth, crowning. Sixth, extension of the head. Seventh, external rotation and restitution. And ninth one is lateral flexion or delivery of the shoulder. Okay, these are all the points we have to remember. So first moving to the mechanism descent. Our first mechanism is descent. Three main reasons are there for descent. The first one is uterine contraction. Second one is amniotic fluid pressure. Third one is abdominal muscle tone. The abdominal muscle tone is increasing during labor. So this is all about the descent. Our second mechanism is engagement. What will happen in the engagement? Large diameter of the fetal head descend into the maternal pelvis. So this is the engagement. How we can identify the engagement? During abdominal palpation, we can identify whether the fetus head is engaged or not. So this is about engagement. Our third mechanism is flexion. The name itself we can understand something flexioning. So here the baby neck is flexioning so that it's moved to chin to chest level. How it is happening? The continuous contraction of the mother, the fetal head come into the contact with the pelvic inlet. So here what changes is happening? The cervical flexion is happening. Now the presenting part of the fetus is suboccipito-pragmatic. The measurement is 9.5 centimeter. So this is all about the flexion. Our fourth mechanism is internal rotation of the head. What is happening here? The head is rotating at 90-degree angle. How? The maternal pelvic floor has a gutter shape and downward slope. So it is easy to help the fetus head rotation, so that it's encouraging the fetal head to rotate from the left or right occipital transfer position to the occipital anterior. Here what will happen? Stiffness of neck to the fetus. That means we can say torsion of the neck to the fetus. So after that, a regular contraction of the fetus moving into the vaginal canal. So now we can see the fetus vertex visible at the vulva. Here the second stage of labor is starting. This is all happening in the fourth stage of mechanism, that is the internal rotation of the head. Our next mechanism is crowning. What will happen in the crowning? When the widest diameter of the fetal head successfully negotiate through the narrowest part of the maternal pelvis. So here the head is fixed in the pelvic floor. It will not come back. That is the meaning of the crowning. Okay, this is our fifth mechanism. Our sixth mechanism is extension of the head. The name itself we can understand the baby head is extending. How? The occiput slip beneath the suprapubic arch and allowing the head to extend. So we can see the vertex, then we can see the eyebrows, then we can see the fetus face, then we can see the chin. This is happening in the extension of the head. Our next mechanism is external rotation and restitution. What will happen here? Once the head is delivered outside, now the shoulder reach to the pelvic floor. So visually we can see the head externally rotate to face the right or left medial thigh of the mother. So this is the external rotation. What is the restitution? What will happen? The shoulder are rotating from the transverse position to the anterior posterior position. So here the realignment of the shoulder with the head is called restitution. Here one more important point is when the restitution, that time the torsion of the neck also released to the fetus. Before in internal rotation of the head, we can see some torsion of the neck happen to the fetus, stiffness. So that one here it is released. So this is all about the external rotation and restitution. Our last mechanism, lateral flexion or delivery of the shoulder. How we are doing this one? So here two main important points are there, downward traction and upward traction. So first we will see what is the downward traction. When we are doing the downward traction, you can see the anterior shoulder below the suprapubic arch. Then you can deliver the anterior shoulder first. Once it is completed, we are going for the upward traction. So when we are doing the upward traction, we can see the posterior shoulder below the suprapubic arch. So we can deliver the posterior shoulder. So once upward traction and downward traction is completed, we can deliver the baby trunk and leg automatically it will come out. So this is the way how we are deliver the baby. So the assistant will give the support to prevent the perineal tear when we are delivering the baby. So these are all the mechanism we have to remember when you are writing the exam as well as the practical. Finally, I will give small recap of this topic. Our first mechanism is descent, second engagement, third neck flexion, fourth internal rotation of head, fifth crowning, sixth extension of the head, seventh external rotation and restitution, and ninth one lateral flexion or delivery of the shoulder. Here main important points, downward traction and upward traction. So hope this topic is understand for you. Thank you.